This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Eltroxin 100 micrograms tablet is essential for managing thyroid hormone deficiencies. It plays a vital role in regulating metabolism and overall health. Indications and uses. This medication is indicated for the treatment of hypothyroidism, a condition where the thyroid gland does not produce sufficient hormones. It helps in restoring normal hormone levels, which is crucial for maintaining metabolic functions, regulating body temperature, and supporting proper growth and development. Additionally, it is important for maintaining normal brain functions and supporting nutrient absorption. Those with specific underlying conditions, such as coronary heart disease or adrenal insufficiency, should be closely monitored while using this medication. How it works. Eltroxin contains thyroxine, which is essential for controlling metabolic activity throughout the body, ensuring proper functioning of vital organs. Directions for use. Take this medication in the morning on an empty stomach, at least half an hour before breakfast, or as directed by a healthcare professional. Swallow the tablet whole with a glass of water without chewing. The exact dosage and duration of treatment will be determined by your doctor based on your individual health status, age, and body weight. Possible side effects. Common side effects may include increased appetite, weight fluctuations, headaches, vomiting, diarrhea, changes in menstrual cycles, fever, sensitivity to heat, cramps, and mood swings. It is advisable to consult a healthcare provider if any side effects worsen. Precautions and warnings. Prior to starting treatment, consult your doctor if you have existing health conditions such as coronary heart disease, adrenal insufficiency, or if you are pregnant or breastfeeding. Regular monitoring and communication with your healthcare provider are crucial to ensure safety and effectiveness during treatment. FAQs. 1. What is the use of this medication? It is used to manage thyroid hormone deficiency. 2. Can I take this if I have diabetes? Inform your doctor, as it may affect blood sugar levels. 3. Is it safe during pregnancy? Yes, but consult your doctor beforehand. 4. What should I do if I forget a dose? Take it as soon as you remember, but skip if it's close to the next dose. 5. Who should avoid this medication? Those with unmanaged hyperthyroidism or pituitary insufficiency should not use it. Thank you for watching. If you have any questions or suggestions, please leave them in the comments below. Your feedback is valuable to us.